Hi guys, I am Tudu Eto.
Hi everybody, I am Marsha and we are the brains behind We Nurse You. Alright, so today we've got a very exciting content for you guys and I'm going to hand it over to Tudu Eto to tell you what today is all about.
Okay, so sometimes you'll be wondering and you don't know what's going on. So you'll be having this funny feelings, you're feeling sick, and you know you were busy withdrawing some other time without using protection, and you are pregnant.
Yeah!
Congratulations! So these are the symptoms that you might be experiencing before you could actually try and make a pregnancy test. So let's just find out what would be happening with your body.
All right, so please note that some of these symptoms that we are going to talk about are not applicable to everybody. Remember, everybody's body is different and we all react differently to different situations. But the most common pregnancy signs that you may be experiencing would be the morning sicknesses. You feel like throwing up all the time. You eat, you throw up. You don't eat, you throw up. You just sitting there, you feel like you want to throw up. And sometimes they call them morning sicknesses, but they happen throughout the day. You'd be feeling like that the entire day. For some people, it's only in the early hours of the morning and then it goes away. And then another sign would be feeling like everything smells. Your favorite perfume doesn't smell so nice anymore. Your favorite meals, people would be having a beautifully cooked home meal or your favorite takeaway, and then you feel like, you're like, yo guys, what is this?
But we also know your secret. Some of you actually know about the symptom, but you actually try to hide behind it. So not everybody's gonna experience this one.
Yes. And then from there, sometimes you're feeling a little bit dizzy or lightheaded and you're not too sure what's happening, and then you get a lot of headache and you don't understand what's going on. And then sometimes when you eat your favorite meals, like we were saying, not only do they smell differently, but they also taste weird. So there's quite a number of things that would be changing around. But like we said, it's not with everybody. And then as time goes on, you might also be spotting. So remember, even with spotting or with missing your period, it might not be the same as everybody else. Sometimes that spotting, you would think that you are actually going on your periods. Kanti, no. This little human being growing inside you is actually implanting themselves. Implanting themselves and making sure they are nice and comfortable in your tummy.
So you'll also have those slight abdominal pains, because remember, this is now a different feeling or something that's growing that has never been there before, especially for your first pregnancy. So you'd also feel a bit of discomfort and all of that. And with your early symptoms as well, some people would also have that metallic taste on your tongue. Not everybody gets that, but it gets to that. Masha mentioned food, your favorite food, then you don't want to eat your favorite food anymore. Even your juice, your drinks, then you actually want to just drink water because you just want a plain taste on your mouth. Besides the vomiting as well, nausea. You just have saliva in your mouth, like, so you don't have to vomit. It's not vomiting for everybody, but you would also have that nausea as well. So some of these symptoms, they go throughout your first, your second, and your third trimester as well. So with other people, they will also have like painful breasts because now they're engorging. Remember, now we're preparing for the milk. So you'd also have that funny feeling as well. And then people would be tired, like your excess fatigue that you don't even know where does it come from. Like sometimes you'll just be chilling at home, you're not working hard, you're not doing anything excessive, but your body would be so tired. So it's also one of the symptoms that you can experience when you're pregnant. And then when you're experiencing all of these, what do we do? A pregnancy test.
You need a pregnancy test, Mtase, because wow, you've been busy.
You've been busy. We need to confirm the pregnancy. Sometimes you might be having one of these symptoms, or maybe some of these symptoms, but you're actually not pregnant after doing the pregnancy test. But now we're talking about a person who is pregnant, and then you do a pregnancy test, you find out that you're pregnant. We also have different types of pregnancy test kits that we use. We've got the ones that we use in the public sector, in the clinics, in the hospitals. We also have your private ones that we also use. And then they also take how long?
So, with different companies and different manufacturers,
Yeah.
you can always read the leaflets. It will tell you, with our tests, be comfortable to take a pregnancy test from 10 days after conception
Yeah.
to 14 days. And then others would say for a safe and more accurate result, take your pregnancy test from 14 days after. So this is where each manufacturer knows how effective their
Yeah, the
pregnancy test
yeah.
would be able to determine the HCG
It's a hormone
hormone. This is a hormone that usually is elevated in women when you are pregnant. So it depends on which pregnancy test you'll be using. Many types of different pregnancy tests that you can go for. Your choice. You can also go for those smart ones that tell you how
how many
far.
weeks?
You know, it can tell them 1 to 2 weeks, 2 to 3, 3 and more. You know.
Yeah, so we can also do the test differently. You can use the urine, that's what we commonly use as well, but they can also take bloods as well. Yeah, so to check your hormone levels, how high they are, if we're detecting pregnancy or not.
And you know, with the pregnancy test, some tests will just give you the 2 lines, and then other times the other line is so faint you're not sure whether it's you're not sure.
Now, baby, Nana is playing, ne?
Yeah,
Or you were talking about?
the test. Okay, so it would have 2 lines. So with the 2 lines, sometimes the other line is so faint you're not even sure if it's positive or negative.
Yes.
And sometimes with some people, the urine pregnancy test will give you certain issues, you know, depending on your healthcare condition and many other things. Hence, we will then revert to taking the bloods. So there are different ways in which we can actually confirm pregnancy. And then sometimes when you come, a sonar will be able to diagnose the pregnancy.
Yeah, because I mean, remember we said we're going to share our experiences as well. So there are people whereby they've done pregnancy tests, they've done the urine test, and we don't see anything, right? And then their tummy is busy growing and growing and growing. So we do some of them, they would do a sonar, they find nothing. It does happen. I don't want to classify the category, but there are those people who are like that, but it does not happen to everyone, remember. So that's where we will step in, and the next thing, boom, Mutu is in labor and you need to deliver. But those are other cases that we'll discuss maybe as time goes on. Yeah.
And then another thing that we also want to discuss is, as soon as you find out that you're pregnant, then what?
What are you gonna do?
What are you going to do? How soon do you go to the doctor, to the clinic,
Yep.
to go and book for your antenatal care?
Yep.
So this is what we call in short ANC, not the political party. So every time you hear us say ANC, we are actually talking about antenatal care. So as soon as you find out that you're pregnant, when do we go for our visit to do?
As soon as you find out, you actually go to the
As soon as,
facility.
like you find out today.
You need to go.
Exactly. So we have beliefs, especially as Africans, to
Yeah.
say, when you find out that you're pregnant, you don't go out and you tell people about it. You must keep quiet, keep it a secret, because some of it, but now, you know what I'm saying?
Yeah.
So it's fine.
Yeah.
Don't tell everybody. You can keep to that. It's okay. But you need to inform your healthcare professional.
Yep.
It is very important. And Dudu, why is it important to go and book? You say you must, but you must wait for 3 months, at
Yeah.
least until 3 months. With us, don't come to us when you are 3 months into the pregnancy. Immediately when you find out, come.
Because
Here's
you're going
why.
to end up missing a lot of things. Remember, we're going to different places. We can go to the public sector, which is your clinics. You can go to the hospital. Some of us have private midwives. Some of you have private doctors as well. So there are certain tests that they actually want to run. When you come to the clinic, we normally do a test called HB, whereby we're checking your iron levels. How high are they? How low are they? You sometimes go randomly, and people be like, "Oh, I can have low blood," and they're actually talking about anemia. You know, so those are the tests that we are doing. When you are pregnant and you have already found out, we're also doing an RPR test. We are looking for syphilis. We need to be able to pick it up if it's there, if it's not there. If it's there, you need to get treatment. Your partner also needs to get treatment. We're doing an HIV test for all the pregnant women that come to the clinic. Whether HIV positive or HIV negative, then we're going to manage you likewise. It's actually better when we find out, let's say, not that we want people to be HIV positive, but if you end up being HIV positive or we find out that you're HIV positive right there and then, we can start you on treatment, which would be very good for the baby, meaning the chances of transmitting the disease to the baby, then they will be minimal, slim. I think it's been proven that people who actually start pregnancy early and who start their ARVs, they hardly transmit the disease to the babies. So we do that, and I know in private sectors they also do genetic tests. You can choose
Which is
to
optional.
want it. It's optional, yeah. So if you've got a genetic history, then you are likely to do it. So they need to do that as well. Sometimes they even get that free fancy sauna that you get to see how the baby looks like and all of that. So those are one of the benefits that you get. You know what I mean? So there are a lot of benefits when it comes to booking early. And as well as we want to find out that for him, how far are you in pregnancy? We're doing, we're checking when was the last period that you had as well. We're also going to measure your stomach. How big is it?
So with the period, we always say your last normal, your last normal menstrual period. So what that means is, remember, if you're a person that goes on your periods for 4 days, and this one time you just happen to go for 1 day or for 2 days, that was not normal. Queer.
That's your abnormal one. Yeah.
So we don't want that one. We want you to go as far back as the normal one that you remember. And we want the first day of you starting that period, not the last day. So the first day that you went on your period. But remember, for some women, it's very difficult to tell the last normal menstrual period. For women with many different gynecological conditions like your endometriosis, your cysts and your fibroids, then you don't have a normal period. Sometimes you go for 2 days, sometimes you go for 7 days. You know, the flows sometimes are too heavy, sometimes they're not. But under general and normal circumstances, we want the last day of the normal menstrual period.
Yeah, that's going to guide us. And I mean, if you're also planning to have a baby, I think that's one of the things that you're actually looking at as well. So bear in mind that it really should be that, we call it an LNMP. Yeah. So that's what we're looking at. It's going to guide us in terms of measuring how far you are in pregnancy. If you're going to give us the wrong date, then we're not going to be able to calculate properly. We mostly align it to your how big the belly is and how the belly is growing. So we call it like a symphysis fundal height. We need to measure how big is it. So how it's going to help us as well, we need to also do a sonar for the first time, which should be done a bit earlier. So the sooner you book, the better we get the results. And let's say, for instance, you're carrying twins. It's not going to be a normal fundal height, you know what I mean? So Masha might be pregnant, she'll be measured, let's say now 14 weeks, and I'm pregnant, I'm carrying twins, then I'll be around your 20 because it's not the same. So we also need to detect any abnormality as well when it comes to you, the baby. We're actually doing a full checkup. We're going to how many pregnancies have you had? How many times have you been pregnant? Have you had a miscarriage before? If you've been pregnant before, were those babies normal? How did you deliver the babies? How much did they weigh? You know?
And are all these babies still here, still alive? Because for some women, unfortunately, they've had unsuccessful pregnancies. Some would not be able to carry the children to term. Others would carry the children to term, and just before they give birth, unfortunately, they lose the babies. Or they give birth, baby comes out alive, and then after a few days, after some time, the baby then passes on. So these are some of the things that we really need to know why and how it happened. And in such cases, this is where we are going to put you on whether you're a high-risk pregnancy or not, because then we want to make sure that we preserve and we save this pregnancy.
So we also want to know your hypertension history, your family history, the diabetes history. If your family members have had, we also want to check yours. if you have any other chronic diseases, we also need to make sure that we manage you very well. Mama Tia. We want to make sure that we are managing you very well.
And remember, all these things are done because as soon as you're pregnant, remember, this is not just about you. This is not just you. And many illnesses and many of these things that we check for are things that will affect you, the pregnancy, the baby, the placenta, which is kobo ya ngwana, you know, that connection between you and the child that's feeding the child and that's giving all the blood and nutrients that the child needs to get. And the uterus, as it is.
Baby, please take her to daddy. Nikki, catch her. Catch her. Take her to daddy.
So it's not about you only. So the everything that affects you will affect the entire pregnancy and the baby ultimately. So most of these illnesses are illnesses that can actually be passed on to the baby, which is not what we want. So these are preventable. Hence, we need you to come as soon as possible. We diagnose and treat you as soon as possible, immediately, and then we are able to at least control it. A lot of them cannot be cured, but we can control them so that they don't take over your pregnancy, and you can enjoy your pregnancy.
You can,
you know.
You can.
So with most of these illnesses being that can pass on to the baby or affect the baby, are preventable, like I said. So you can be HIV positive, both you and your partner, or just you as the mother, and give birth to an HIV negative child. But you coming to the clinic and getting your treatment is very important so that we can assist you in achieving that goal. And then it does not end after the child is born, because isn't it, you'll be HIV positive for life for now, because we don't have a cure for HIV, but you need to protect your child even after you have given birth. When it comes to breastfeeding, when it comes to you taking care of the child after that, we still need you to come to the facility. So we will talk about it once we are talking about delivery and after delivery. And then you've got illnesses like your syphilis. The syphilis is an STI, and this STI can be passed on to the baby and affect the baby at the time that you give birth, and you find that the child is also affected. Hence, we need to do these tests and treat you if we find you to be having syphilis. Illnesses like or conditions like hypertension and diabetes, they can affect your pregnancy to a point where the baby is not getting enough blood or enough oxygen, and there could be so many other things that go wrong. So this is why we need you to come
and book, because we're still getting cases whereby parents don't book and they just show up in the delivery room and then bam. And the one of the tests that we do, the RPR, that's the one that determines the syphilis, which is the STI. If it's not treated or was not picked up, detected when you're still pregnant, it can actually affect the baby's eyes. So we don't want such problems. And you know, once you have booked, we obviously give you a return date to come back to the clinic for follow-up visits. So we mostly advocate for daddies to be around. I think we've seen daddies who are really, really part of their children's life throughout the pregnancy. Then the daddies come and visit. We've worked in an area where it's actually a colored community. Yeah, mostly dominantly. There are people who are mixed and stuff, but predominantly coloreds. We've seen that males actually support their partners. Like those people are there all the time throughout the pregnancy. Sometimes they're even the ones who bring the children for immunization. So they're very, very supportive. And we're also seeing other people coming with their partners as well, but predominantly seen it in that area. So it's actually good. So it was a beautiful thing to see. So we're really, really advocating for partners to come with. Because
so please don't take this otherwise. We are just saying generally among the communities that we've worked in, the colored community that we worked in, almost each baby
as well, you can both do the HIV test together. In cases whereby the lady tests HIV positive and the partner tests HIV positive as well, they can both start treatment on the same day. If the results are not the same, the partner has tests HIV negative, then the partner can be on PrEP. Obviously it's optional. but we do encourage all of that to happen. So there are many benefits that comes with coming with your partner, booking early, and all of that. So it's really a beautiful journey.
And it also has a psychological effect as well. You know, it improves the bond between the two of you. It improves the baby. You know, so it's very important. And we do know that a lot of our African brothers out there, they really want to do this, but I don't know if it's fear of coming to the facility or what,
or how other males are looking at them.
So please don't be ashamed. And we know that we are, just by saying that in the colored community that we worked in, most colors made sure that they come with their partners. Does not mean the other races did not do it. Yes, they did it, but we saw them doing it more often, and a lot of them were doing it more than with other ethnic groups. But we're encouraging it, guys. Come. And now we are in a generation where fathers are hands-on. They're involved and they want to. Don't be afraid. Support your partner. That's one of the greatest things you can do during the pregnancy. And when one partner tests negative and the other tests positive, we call it the discordant couples. It's not the end of the world. Like Dudu has just said, we are going to put you on PrEP if you want it, and which is very highly advisable. And then we can also make sure that the two of you work this journey and you understand what's happening, you understand your results. And then you keep the relationship going and strong. And another issue would be if the partner is unable to come because of work and other things, we advise that the partner still goes and tests, because remember, if I'm HIV negative and the partner is HIV positive unknowingly and I'm not yet infected, and I test and he thinks that just because I tested negative he's also negative, like guys, please, everybody must come and test for themselves, so that if I'm negative and he's positive, and along the way we'll just be not protecting ourselves, thinking that we are both negative and we are safe, only to find that as time goes on, then I also seroconvert and then I also become positive, which puts the baby at risk.
And we are also getting those cases whereby you book for the first time, you are HIV negative throughout the pregnancy, then come 32 weeks, 36 weeks, then you test and you are HIV positive.
You understand? And hence we advise that every visit that a pregnant woman comes to the facility tests for HIV, because remember, you could be in the window period, or it could be your partner who's in the window period. And then if you test once and you think you're negative, along the way, if you seroconvert, we are not going to know, and precautionary measures will not be taken.
And at the same time, we're not forcing people to test, but we're actually advocating for them to test, because it's for their own health benefit, you know, for the baby. Because remember, when you're pregnant, you're carrying another life inside of you, so you really need to make sure that you're taking care of that baby. It's going to be a nice journey, and you know, when we spoke about the partners being around and it playing a very big role on a person psychologically, the pregnant woman specifically, remember, you're going through a lot of things. Your emotions are raging, so sometimes you don't even know if you're coming or going, and then they sometimes call it a porridge brain, because you tend to forget a lot of things. So having somebody supportive next to you, it actually makes your life a bit better. So your mental state will be in a good state, you'll be in good health, so you'll be able to be having a healthy pregnancy and a healthy baby as well. Because if you're frustrated and stressed, I mean, all of the stress can go to the baby as well, so we don't want all of that to happen. So also during the pregnancy, the antenatal visits, there are a lot of things that are involved, like we're telling you about this is the stage where you add, you're going to start feeling the baby moving from this time, depending if you're a first-time mom or a second-time mom. We'll be touching that a lot as time goes on. So we're giving you a lot of information. This is what you're supposed to be expecting at this time around. We want to know, is the baby moving properly? What are you eating? If we're finding that your HP levels are a bit low, we advise you, okay, try and get this and this. What we're also giving you, it's supplements. A lot of people opt for omega-3 plus. In the facilities, we would give you your vitamin C, your ferrous sulfate, your folic acid. It's a whole combo. That's also in the omega-3 supplement as well. That's combined. So that's going to be your vitamin supplement throughout your pregnancy, even up until 6 weeks after delivery. So that's going to be your booster. If we need to take bloods at certain times, we're also going to be giving you that schedule, your Bank Plus visits, when are we coming back, when are the important dates to test, and for which tests are due at that specific time as well. So yeah.
And one of the tests that we forgot to mention was TB. Remember, in South Africa, TB is the #1 killer among many other illnesses, but TB is rife at this point.
And in the world, I think we're at number 3 currently right now. So
when
TB,
it comes to TB infections and TB patients or people that pass on due to TB tuberculosis. So it's very important. Hence, we, with all mothers that are pregnant, we do a TB test. So when they ask you to produce a sputum or to give them sekgohlela, please don't look at them weird. It's just a precautionary measure, because we found that sometimes you don't need to have the TB signs or the symptoms for you to have it. I've once had TB, and you can ask, we worked for a very long time, and the signs, I didn't have signs at all. Yeah. But part of it could be because it was an extra pulmonary TB, which is TB outside the lungs. So there's different types of TB. It's one that's most common, that stays in the lungs. It can be passed on easily to other people through the air. It's called airborne. And then you've got TB of the blood. You've got TB of the
hand as well. It's a lot.
It's a lot of the bones, you know, of lymph nodes and all of that. So hence we need to test for TB on the pregnant women, because we want to keep you and the baby alive and safe and healthy.
And you know, we currently have the latest guidelines running, and like Marsha said, that most of the time you find that people who don't have symptoms are the ones that have TB. And it's even written to say most of the time those are the people who tend to have TB. Not to overlook the other signs as well, but we are trying to cover the case finding of TB a lot. A lot. Yeah.
Which is very important, not just for you and the baby, but also for your family members. Imagine being TB positive or being infected with TB and you do not know, and yet you go home and you pass it on to the rest of the family. Now everyone else is sick out there,
even the baby,
your family,
so they're more at risk.
So it's very, very important. So this part of the video, we will just only cover this section of you booking and coming to the facility. Remember, you book as soon as possible. All these tests that need to be done, you cannot do them at home, and some of them you coming at a much later stage is not really going to assist us. Something as simple as a sauna, it's more accurate or earlier if it's done earlier, as opposed to when you do it much later. So,
and I think what's also nice is with the ANC guidelines. I remember before, people used to struggle. You would say, I'm referring her for a sauna, and then they get to the hospital, no, you can't do a sauna. But right now, you're being supported by the guidelines and policies to say, look, each and every pregnant woman needs to have a sauna done. So don't be scared when you go to the facility. I mean, sisters are there. You can ask questions and ask, sister, you know what, I'm really not sure about my dates. Can we do a sauna? If you can't do a sauna at that particular time, then they need to give you that information to say, look, not now, or your dates are aligned, or all of those things. But each and every pregnant woman needs to have a sauna done, right? Yeah, so it's actually very important.
And then from there, we also highly advise that you keep healthy. Stay away from alcohol when you're pregnant. Your hablies, if hablies, cigarette, all of those things, because please
stop. Actually,
you need to stop. You need to stop, because they will definitely give a negative impact, or they have so many disadvantages for the baby.
Fetal alcohol syndrome, which is very popular, has a high rate in the Northern Cape. I'm from the Northern Cape anyway. But yeah, it's actually very high that side. And smoking, you're actually damaging the baby. You're breathing as well. You're pregnant, you're carrying a life on you. When we're talking about those remember, you're not only restricted to go to your public facilities. You've got the clinic, you've got private midwives, you've got your clinics,
gynecologists,
your private doctors. So certain things, there are people who would come and say, no, not your doctor. But there are certain things that the doctor cannot do. There are certain bloods that the doctor does not do at a certain time, whereby in a public sector they actually do. So the monitoring of a pregnant woman in the public sector, I don't want to lie, guys, it's actually good. It's done properly because we need to align things when it comes to guidelines. We're doing file audits to see this person is pregnant, was booked at a certain time, were bloods taken at that particular time. So there's a lot of admin that goes on. So even if you see the queues are too long or it's slow and all of those things are actually being done the proper way.
So the one thing that a lot of people would complain about in the public sector would be the waiting time. And unfortunately at this point, there's very little that we can do about the waiting time because of staff shortage, because of the influx of patients that we have that we need to see. But I promise you, the care that you will get there is
optimal,
the best. We try and we do as much as we possibly can. And please, let us not label all our nurses according to one bed experience. I always say to my patients, if you go to a supermarket and you want to buy bread, and the lady that's cleaning there or the cashier gives you attitude and there's a back and forth between you and her, are you going to leave the bread and no longer buy? No. If you go to the bank, you want your money or you want to get your account in a good status, and the cashier or the lady, the teller comes and you don't agree on something, are you going to leave your money and go? No. So when you come to the healthcare facility, let's not go because certain people normalize reporting people. Normalize reporting people that are doing please utilize that. If people are not treating you how you're supposed to be treated, normalize reporting. And also normalize being patient, normalize doing the right things, normalize being what you would like the next person to do for you and to you. And there are a lot of complaints and treatment as well. So maybe one day we'll talk about the complaints and what happens in the public sector, but that's I think that's a whole subject on its own. But we are really advocating for us to go and visit. If you want to go to a private doctor, it's okay, you can go if you have the funds, if you have a medical aid and all of that. If you don't, please make sure you come to us. We are ready to nurse you. And I'm pretty sure that we have seen one or two or many good nurses in the public sector that really treated us well. So let's not paint everybody with the same brush. You wanted to say something?
So you're gonna make me jump on the last one now. I wanted to say, as much as we are in different professions, a person is an individual, right? So there are many people with different attitudes and bad attitudes as well. So you find them everywhere else.
So we'll hope to see you. If you know that you have a little tinky winky, little lala,
a bun in the
oven, something is cooking. We can't wait to see you.
And what we can also do is, we work in different areas. Maybe you want referrals, you stay in a particular area and you want to know where can you go, where can you get help. Then, you can ask us, send a comment down below so that we can give you instructions, link you to certain types of people that you can link with. We're not giving special favors. We are directing. We say, you are in Soweto, there's Protea Clinic, there's what, you're in Ekurhuleni, because we've worked in most of these districts. So it's just a linkation to tell you what can you do, how do you go about getting your help.
And trust me when I tell you that we've got, let me not say connections, but we know a lot of people, a lot of our colleagues, those we studied with, those who were our mentors, those whom we've worked with. Mamela from Cape to Cairo. If you need, we got you. If we do not know anyone in that area, we will know somebody. We will definitely
or
make sure.
Somebody would even comment.
Someone will comment and say, okay, no, I can assist you, or I can help you, or I know someone that can assist. So we will definitely make sure that we try and get you the help that you need. So if you need information about anything at this point, you can come through, no matter where you are. We always know someone that knows somebody somewhere
that can make things happen
happen for you to be seen and to get the assistance that you need, whether it's with your pregnancy, whether it's with your baby, whether it's with your treatment, and any of those things. So holler at us, and then we will get in touch with our colleagues, and let's make it happen.
Yeah, let's make it happen. And with certain things that we have not touched on, because we're just covering the antenatal booking. You've got questions, put them there, and then we'll cover all those questions and your concerns at all.
Definitely. And everything else that you would like us to talk about, or something that we discussed here and we didn't go into detail, you can tell us that, no, please explain this, and then we'll make a video especially for you, because we nurse you.
Yeah.
All right. Thank you, guys.
Thank you so much.
We
See
love
you on the
you.
next episode. Bye.
Bye-bye.